Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Tuesday, December the 14th. We're honoured to be here on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations, honoured to be here on their lands today. I would note, for those of you looking forward to future weeks, future weekly presentations, will be a briefing on December the 21st. And then the briefing following that will be December the 29th. Obviously, Dr. Henry and I will be be around during this period, but those are when the regular weekly briefings are, so you can plan for that. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. Today we'll be sharing the latest on our COVID-19 public health response and our December epidemiology and modelling update. Before I share the modelling information, I did want to pause and acknowledge the fact that we have lost a record number of our community members to the toxic drug crisis here in BC in the month of October. Like those who have died as a result of COVID, these are our uncles, brothers, family members, friends and colleagues, and we mourn with all of our families the loss of our community members. And I commit to continuing the efforts that we have been making, too slowly, unfortunately, for so many, since the toxic drug crises started a number of years ago. And back to COVID-19, we are in a place right now where there's still a degree of uncertainty, as we talked about yesterday. So it is, or last week. So it is important and timely for us to go through where we are with our pandemic here in British Columbia. To start with, this is the geographic distribution of COVID-19 by local health area with the week of November 28th to December 4th. As you can see, we continue to have high rates of transmission in some communities around the province, but we have also seen dramatic decreases in communities where vaccination rates in particular have gone up. So we still have challenges in areas in the north, particularly in the Peace region. We have seen cases come down in Fort Nelson, and that's great to see, as well as in areas around Golden and in the interior. This is the cumulative case rate over the since the start of the pandemic, and we can see that there are no parts of the province that have escaped this virus, and that is what we are seeing now, that the virus is in our community and that we are learning the important things that we can do to protect ourselves from illness, protect ourselves from transmission, and particularly to protect ourselves and our communities from severe illness and hospitalization. And one of the most important tool that we have now, and if we reflect on it, it's been a year since our very first vaccination clinic, which was on December 15th last year. And in that year, we've immunized close to 9 million doses of vaccine have been delivered across the province. We see now that across the province, our rates of first dose of COVID vaccine are above 70% and actually closer to 80% across the province now for the first time. So that's great news. And where we see the triangles indicates where we're seeing the most increase in first doses, and that is great to see, is in places in the Peace River, in Fort Nelson, in the Caribbean-Chilcotin areas, in Quesnel. Important gains that we have made in protection in those communities. If we look at second dose, again, it reflects that we now are above 60% and close to 70% across the entire province, and increases in those areas that have been dramatically affected in the most recent months. And we see the protection that we get from vaccination. And now we know that we need to focus as well, after 6 months, on enhancing that protection through the booster dose program. And I'll talk more about that. But we see here that we see direct correlations with the rate of vaccination in communities and the rate of transmission of COVID-19. This is our epidemic curve from January of this year. And we can see that in August, September, we really saw that surge in cases, primarily in interior health. We've seen that come down now, leveling off a little bit in the last week or so. And we have seen a dramatic decrease in northern health finally in this last few weeks. Where we've seen an increase that is concerning, of course, is on island health that has had very low rates for for most of the pandemic. And there's a couple of reasons for that in island health. And we're also seeing a leveling and a slight increase in Vancouver coastal health. So this is our epidemic curve broken down by cases on the top. As we can see, we've had a nice steady decrease over the last couple of months, although a leveling off in the last 2 weeks, which we need to understand more thoroughly. Importantly, we have seen, we've turned that corner on hospitalizations, which continue to come down. And thankfully, we've had low rates of deaths across the entire pandemic. But if we break this down of where we're seeing cases, it really tells us the picture of people who don't have the protection that vaccination gives us, have a much, much higher rate of getting infected with COVID-19, getting sick with COVID-19, and being hospitalized with COVID-19, related to the very low rates of hospitalization, particularly that we see in people who are vaccinated. And if we look at this over the entire the health regions as well as by BC, we see that we've had a dramatic decrease in Fraser Health, in the interior, in the north, with a steady decrease both in cases and hospitalizations, which is very good to see. Where we see an uptick, a little bit in Vancouver coastal, but concerningly, of course, on Vancouver Island. In the background, which is a little bit faded, those are our testing rates. This is something from the very beginning that we have focused on, making sure that we have the accurate PCR testing available to people in the community, and we have had very high rates of testing across the communities, across BC, over the last period of time during this wave, and we are now starting to see decreasing percent positivity. But I think it's important. One of the focus that we've had is making sure that we have the right test for the right people. And that means making sure we get the gargle test for children who've been exposed, who have symptoms, who can get tested easily, making sure we have nasal testing and NP testing, and where it's appropriate, of course, the rapid antigen testing to supplement. But this is the PCR testing that we've had the highest amounts of testing across the province over the last few months, and that gives us a good sense of where we're seeing transmission. And you can see that we've had decreases everywhere, particularly important in the north, where we finally are down below 10% positivity for the first time in many months. If we look at the epidemic curve by age groups, we can see that the highest rates of cases, the highest numbers of cases, continue to be in young adults, particularly the 30 to 45 age range, and that is what's driving much of the pandemic. We are seeing an increase in younger children, still at a relatively high level, but we've also seen the impact of the booster doses in the 70 plus, where those rates are coming down nicely. If we break down this, of course, by vaccination status, we see again the dramatic protective impact that vaccination has across all age groups. And this is a year into this, knowing how important it is to get that primary series of vaccine, and now, of course, the booster doses driving down risk in older age groups. If we see the 60 to 79 coming down in the last few weeks, and where we still see a leveling off of transmission and some spread in communities is in younger children who are not yet vaccinated, particularly that 9 to 11 age group. So that's where we need to focus and make sure that we protect our children and stop transmission. If we look at, again, we've been following, especially since the past summer, where we saw increase in hospitalization rates and more severe illness in younger people. We've been following the hospitalization counts and rates. They still remain low for children under age 19. And we see nicely in this graph the rate per 100,000 and the numbers of people over age 80 has gone down. And again, that reflects the booster dose program that started a few weeks ago. If we look at our vaccination in BC over time by age and dose number, the dose 3 is on there now as the darkest purple line. We can see that as of December 7th, we had been fully vaccinated, which is 2 weeks past dose 3, about 60%, and we've now, by the end of this week, we'll have up to 80% or close to 90% of people over age 70 have received their booster dose. And we're making really good progress. When we put this booster dose program out, it was for all adults. And it was using that 6-month marker as an important marker of where we were starting to see decrease in vaccine effectiveness and breakthrough infections that led to hospitalizations. And I'll show you some of those data in a minute. But it really showed us that it was older people who don't mount as strong an immune response that we were seeing breakthrough cases in. So the focus has been on making sure we're protecting those who are most vulnerable. And we've known from the beginning of this pandemic that age is the most important risk factor. So our booster program has been focused on those over age 70 who received their doses first. But we've also been making sure that we provide booster doses to healthcare workers, starting from those who received their vaccines first, the people in long-term care and assisted living and acute care. And that program is ramping up as well. And we've been providing booster doses to anybody who reaches past 6 months, people who had 2 doses of AstraZeneca, and Indigenous people who we know got early doses of vaccine in a whole of community approach, and now being able to provide both dose 1, dose 2, and booster doses for the elders and seniors, and of course the all-important dose 1 for children 5 to 11 in many communities around the province. That's been our focus in the next little while, and today we've made the announcement about working with pharmacies and onboarding pharmacies to the system so that they can provide booster doses in communities around the province, and over 500 pharmacies are part of that now, and by early January we'll have over 1,000 pharmacies to speed up and provide booster doses to people by risk as you reach that 6-month time window. So we've added a little bit more information to our donut slide, as I call it. So this is a look at the whole population in British Columbia. We have 73% of the population who's had 2 doses, and we've had another 4% who've received either a 3rd dose because they're immune compromised or a 3rd dose as a booster. So with the very small percent of population that is unvaccinated, and a good proportion of those are children. It's about 9% that are not yet eligible for vaccine, and those people account for 54% of the cases that we saw in the month between November and December. But more importantly, what we're seeing is if you don't have that protection, that immune support that vaccination gives, you are much more likely to end up in hospital. And 68% of people who are hospitalized are people from that very small group who've not yet been vaccinated. And 78% of people in our ICUs and critical care are people who've not been vaccinated. If we break that down further, and this looks at the age groups, and it really shows that picture that age and not being vaccinated are what put you at risk of being hospitalized, what put you at risk of requiring ICU, intubation, critical care, and put you at risk of dying. I talked about the breakthrough cases that we had in people who have been vaccinated, and that in terms of hospitalizations, it really is people over the age of 70 particularly that were much more likely to be hospitalized, and that's one of the pieces of information that drove our early booster dose response for people who are in that age group. And we see, again, the next highest risk for hospitalization or need for critical care as people 60 to 69, and we're focusing on those people as well now. If we break it down by age, it becomes really apparent. This is hospitalization by vaccination status and age, and it is unvaccinated people as we get older who are more and more likely to end up in hospital. And this means that in many cases, people had to be flown out of their home communities. Our hospital system was stretched to care for people. And the challenge that we have is we now know that these types of hospitalizations, even with the Delta variant, with the Omicron variant that we're seeing now, we need to protect ourselves. We need to protect ourselves by getting vaccinated. And there is no more time like now that this is important. It's important as we head into this uncertainty of the new strain that we found here in BC, that's here across Canada, that we are now dealing with globally. You need to get vaccinated to protect yourself, to protect your family, and protect your community. If we look at age-adjusted data that we have from here in BC, it tells us that if you're a 50-year-old person who's unvaccinated, you're 7 times more likely to get infected with COVID-19, you're 30 times more likely to end up in hospital, and 50 times more likely to end up in ICU than your partner, your friend, your colleague who's vaccinated at the same age. This is important. This is what we need to focus our attention on, making sure we're all protected so that we're not ending up in hospital. We don't have to go through the issues that we know lead to long-term side effects, lead to long COVID, all of the other things that happen when you're infected with this nasty virus. Just to give an update on the pediatric profile, between December 2nd and 8th, the latest data, we've thankfully only had 1 new hospitalization in children in that age group. And however, we still are seeing 500 young children in the 5 to 11 age group a week being infected with COVID-19. Thankfully, most of them get mild illness, but you can bring that illness home. You can transmit it to others. We know the disruption it's been causing to schools, to activities that are so important to young people. And now we have a pediatric vaccine that works specifically to protect young people. We've got to about 40% of children who've been registered, so 40% of the 5 to 11-year age group across the province have now been booked or have received their vaccine. But we need to get those numbers up. Now's the time to protect those young people as we're seeing new and more transmissible strains being entered into our community too. If we look across the province of where we're seeing younger people, the incidence really reflects the incidence in communities. As we know, in the interior and northern health, we started to see a decline, although that has leveled off a bit. And again, we're seeing transmission in those younger age groups that aren't yet protected through vaccination. And we've seen an uptick as well on island health, which is a little bit concerning. We know there's been some outbreaks or increased transmission in communities in northern part of island health, and that's reflected in some of these data as well. A recent outbreak in older children and young adults at Uvic. If we look then at what we're seeing about vaccinated or unvaccinated in pediatric age groups, we have seen 0 hospitalizations in any 12 17-year-old who's been immunized, and now we've started to see the 5 to 11 young people being immunized as well, and there's been no hospitalizations among vaccinated children in this province. That really tells you how important this is, and the cases are considerably higher in children who are non-immunized. We continue to do a lot of testing of children. This has been a focus, as I mentioned, to make sure that we have rapid PCR testing available for children to be able to detect COVID most accurately, particularly when it affects their school and their activities. And we have seen high rates of testing across the province and across the age groups, and most of those test positivity rates are now coming down. We've seen a leveling off that is still concerning in that 9 to 11 year age group again. Next, I'm going to talk a little bit about our whole genome sequencing and how we've been using this to understand which strains of the virus are causing illness in the province and how they are changing over time. So this goes back to January of 2021. As you could see, we had a whole variety of different strains or variants of the virus, and then we were really had a dual pandemic of mostly alpha, which is the purple on the top, and gamma, the orange. So those took over in about March of last year as we were coming out of our third wave. And we had a lot of both of those, but in different areas of the province. So we were unique across the country in the patterns that we were seeing of variants that were causing transmission and causing outbreaks and causing community transmission across BC compared to other provinces, even our neighboring province of Alberta. And we see that as well with Delta. So we've broken this down into Delta as it has emerged over time, has mutated slightly, so that there's several different lineage, several different variations of that lineage, be like siblings essentially, that are slightly different. And we've seen different patterns of transmission of those lineages, which means we've had introductions that have had some small mutations and changes as the virus has moved through populations in different parts of the province. We can see that we did have Delta introduced back in April of last year, but it wasn't till the summer where it really took off and replaced both the Alpha and Gamma. And it was primarily the AY25 and 27, the Western variants that we've been seeing on a provincial basis, but we have seen some focal areas of transmission of other Delta lineages. And if we look at this, it just puts the to me, I think it looks like a bit of an art picture, a modern art picture. But if we look at Island Health, for example, where we've had much more of the Delta AY4, particularly in the last little while, compared to some of the other areas. And this highlights as well that in VCH we saw a lot of Gamma, while in places like Interior and the North, it was really Alpha that was causing primarily the transmission earlier on this year. But it has been replaced by Delta, but different types, slightly different strains of the Delta in different parts of the province. And we, of course, have been using whole genome sequencing to understand transmission patterns, to understand outbreaks, to understand where introductions are coming, and, of course, right now, to help us understand where we are seeing Omicron, where it is spreading, where it's coming from, and how we can manage to try and contain it and slow it down if we can. We now have, we are sequencing again 100% of our cases unless there's an issue with one of the with the sample, so close to 100% of cases. It is still Delta that is causing the majority of our infections. We have had, as of the end of December 12th, 44 confirmed Omicron cases. Of the 5 in Island Health, 4 of those are associated with the outbreak at Uvic. And it looks like that outbreak has been driven by Delta, as well as an introduction in partway through of Omicron related to a rugby tournament that has sadly spread Omicron to communities and university communities across the country. We are continuing to detect Omicron, and there will be more cases. We will be updating the numbers twice a week to make sure that people have an understanding of where they are. But I think it is important to know that we have transmission in the community now, and that we are learning more and more from the global community about what that means with Omicron, and what are the measures that we need to think about to get us through this period as we learn more about the virus. So we've had 24 cases in Fraser Health. The age range is relatively young, and that, of course, reflects people who travel for the most part. We've had no hospitalizations in the cases yet of people who have been identified with Omicron. That again reflects the fact that most of them have been vaccinated and that they're mostly younger. So we still can't say enough, can't say much yet, although we have been sharing, of course, information across the country, and we know that in places like Ontario and less so, but also Quebec, Omicron is spreading rapidly, and we're getting more and more information of who's been infected. Most of our cases still have recent travel histories to a number of different countries. More so recently, we're seeing cases coming in from the USA, as well as Iran, where we've had a history of exporting cases into British Columbia. So the early identification of the outbreak through sequencing helps us understand what is going on at Uvic. As of yesterday, there are 124 cases associated with a number of social events off campus for the most part. And so we are now looking at how many of them are Delta, how many of them are Omicron, what are the connections, and managing to control that outbreak with Island Health through the use of sending people home with rapid testing. If you're contacts while you're in isolation, you can test yourself sequentially to see if you develop this illness, and that helps support people to isolate appropriately as we get through this. This is a highly vaccinated population. About 97% of the university community at Uvic has been vaccinated, so we expect that we have so far seen very mild illness in most people, although it is not innocuous. There are some people, young people, who are getting quite sick with this, not sick enough to need hospitalization, but it certainly is a serious illness. Finally, I wanted to talk a little bit about one of the other surveillance tools that we've developed and are using here in BC, and I mentioned this last week, and that's our wastewater surveillance program. So this is a really innovative program that we've been partnering with researchers at UBC and the BC CDC team. And they've developed protocols for sampling wastewater, which sounds simple, but when you have a lot of water, how do you detect a virus that might be in it in a very small amount? So those, the protocols for how to do that, how to isolate the virus, and how to then go ahead and do whole genome sequencing on wastewater samples has been something that has been really helpful for us and has been a really innovative way of trying to understand the virus in our communities. And so this work has been done in the Lower Mainland, particularly, and around the Metro Vancouver area, and about 50% of BC's population. And while in and of itself it doesn't tell us exactly what's happening, what it is another stream of surveillance that helps us put a bigger picture together of whether we're missing something. If we see an indication of something lighting up, as we call it, in the wastewater surveillance, we can go back and look at what's going on in that community. Is there something we're missing? And the whole genome sequencing helps us understand the ratio of different variants and what types of strains of the virus we're seeing in different communities. So this is the pattern that we're seeing from the Fraser Health region, from Annacis Island and the Langley area, and the circles represent where we've had virus detections in the wastewater, and we can see that it really nicely reflects what's going on in the community around it. And it has been helpful for us. One, as a way of saying we're looking at these measures to see if we're missing transmission and missing cases. And for Annacis Island, for example, and Fraser North and South, as we saw cases come down, the wastewater detection and surveillance stayed low as well. So those are reassuring things that help us know that we're not missing things. And we've seen the same pattern in signals from around Vancouver coastal areas, Lulu Island, Iona Island, and Lions Gate. So this is just one of the other tools that we've been using all along to help us understand how this virus is moving through our communities, what different strains of the virus we're seeing, and then that helps us understand what measures we need to take to try and control this, or minimize the impact. So finally, the modeling. recent trends, we've seen that we had been slightly below 1 for the last few months, which reflects the reproductive number that every case has been transmitting to less than 1. Over the last week, we've seen that gradually rise in some areas, and that's something that we need to pay attention to. It tells us that we're starting to have more contacts, infectious contacts where this virus can be transmitted. Fraser Health is still below 1, but we've seen an increase in Vancouver Coastal and Vancouver Island, I mentioned, related to some large community transmission events. We've seen interior creeping a little above 1, where we've seen a dramatic decrease, thank goodness, in the north, where the impact of this virus has really been tremendous over the last few months. So that's something that tells us that we are on a path that has been slowly going down, but now is leveling off and can become worrisome. So the modeling that we've put together is some potential scenarios with a lot of uncertainty. These are the things that we're looking at to say what could happen with different scenarios if Omicron starts to spread widely and displace the Delta that we've been dealing with for the last few months. So what this does is offers us a chance to look at different potential things that could happen and understand what we need to do to prevent those from happening, to keep our rates low and slow over the next period of time. So we know there's a lot of uncertainty still about Omicron. There is consensus that it spreads faster than Delta, that it's more infectious. But how much more is challenging to know. We know that it can cause increased breakthrough or increase reinfection in people who've had previous infection. That's been shown quite clearly in South Africa, where there's a high rate of previous infection in the population, and people are more likely to get a new infection with Omicron than they were with Delta, with Beta, with the other variants of concern that we've seen. That is another reason why, more than ever, if you've had a previous infection, you still need to be vaccinated. Vaccination protects against this reinfection that we're seeing more commonly with Omicron. We don't know yet if Omicron will be able to evade the immune defenses that are given through vaccination. There's some smaller studies, we're putting these pieces together, but there are some smaller studies using neutralizing antibodies, so using antibody from blood and seeing if it binds to the virus, that suggests that that antibody response is less against Omicron than it was against Delta. What that doesn't tell us, though, is the second part of the immune system, whether our cell-mediated immunity still has a strong response against Omicron. And one of the things that we look at to that is hospitalization rates. So there's still a lot we do not yet know about this new strain and how it may affect transmission, how it may affect the people who go to hospital. But what we do know is if cases go up, the percentage of people that end up needing hospital care go up as well. This is a time more than ever that we need to hold the line. We need to continue to do those things that we know work, and they work against the strains that we've been dealing with for the last year and a half, but particularly for the last few months, and they will work against Omicron. That means getting vaccinated, making sure everybody in your family, everybody in your community is protected from this strain, from Delta, from hospitalization by getting their first dose, by getting their second dose, making sure children are protected because we don't want them to be sick with this virus. And it means, importantly, making sure that we get your booster dose when you're due for it. And we are ramping up that booster dose program to make sure that we can get as many people as possible in the next little while. And and large part of that is because we've had the onboarding of pharmacies across the province, and that will be ramping up in the next few weeks. We've also been expanding our all-of-community approach to make sure that First Nations communities, Indigenous people across the province are protected through vaccination. These are the things that we know work and that will work against Omicron as well. The other things that we have here in place in BC that are really important, that are supporting us being able to manage and live and have the things that we need in our lives, are the mask mandates. And we expanded the scope to make sure that masking was an important part of faith services, all of the indoor settings where this virus can be transmitted, and we know it is transmitted easily, more easily, indoors where there's poor ventilation, where people are crowded together. Wearing masks makes a difference. Now's the time, making sure you wear a good quality mask, that it covers your mouth and nose, and that you are protecting people by wearing your mask, and they protect you by wearing theirs. We also have our BC vaccine card in place, and that is a program that helps us mitigate the risk in some of those settings where we can come together knowing that everybody in that setting is vaccinated. It does not eliminate the risk, and we have seen that. We've seen that in group gatherings that have not had the structure of the events where people need to wear masks unless they're seated and eating. Those are things that are really important right now. We should not be having large parties where we're coming together indoors, particularly with people we don't know, where we don't know their vaccination status. That's where this virus is taking hold and spreading rapidly, and we know that that's going to be even more of a risk with Omicron. As we go into this holiday period, I'm asking people to rethink those situations, rethink those parties where you want to be together with groups of people that you may not know. That is a risky thing right now, and we need people to step back, to focus on having those groups with the people who are your close friends, your close family, in a way that protects them. And that means if you're going to have people over to your house, have vaccinated people over to your house, particularly if you have elders, if you have people in your house who are immune compromised. These are important things for us to get through this holiday season. These are the precautions, of course, that we're all familiar with. We have a common foe, as we have across the country. We know that. The experience here in BC, when and how the virus has spread, how we've approached vaccines, and now boosters, is aligned with what others are doing across the country, but unique to the experience that we are having here. Our pandemic response is tailored to our pandemic in BC. But we must remember that we can and must all influence how this pandemic progresses in our families, in our communities, today and tomorrow. That's ensuring everyone in your family has their vaccines, whether they are 5 or 75. Keeping our groups small, close friends, close family, staying outside, keeping ventilation in our homes, opening windows makes a difference. We want to ensure that this time of the year is a joyous time of the year. We want to remember to do those things that are so important to get us through this new uncertain time. So that means going out for a walk with somebody, remembering to find that joy every day in our lives. Take the precautions that we're all familiar with and that we know work, and support each other to do that, as we have been all along, with kindness and compassion. Thank you.
Thank you very much. And for those watching at home, sometimes it's hard to read the slides. A copy of the presentation is being posted to the BC CDC website and will be available at the government website as well. And I encourage people to go through in detail where we are in the pandemic today, and to follow the presentation with a more detailed review of the slides involved. I wanted to update you on a few a number of issues related to the COVID-19 pandemic, and then we're happy to take your questions afterwards. Firstly, our vaccination campaign and program in BC is going exceptionally well, and that's to the credit of the people of BC, of our incredible immunization teams across the province who are doing an excellent job. And today, this morning, here in Vancouver, Dr. Henry and I visited a pharmacy that's part of the significant increase in capacity of the system to provide booster or third doses to people in BC. Pharmacies are on board. They've on board for a little while. It'll be up to past 500 at the end of this week involved, fully integrated into the system. So you book your appointment at a pharmacy the same way you would at a health authority operated clinic, and more than 1,000 pharmacies in January. This greatly increases our capacity for third doses and indeed for first and second doses of mRNA vaccines. To date, 4,316,478 first doses have been administered in BC, 4,105,425 second doses, and now 610,264 third doses, which is ahead of the schedule that we presented. There is sometimes discussion of when we present something against other jurisdictions. And note that we laid out our plan in detail 7 weeks ago. We're ahead on that plan. The numbers that we presented in terms of our expected vaccinations between 7 weeks ago and the end of the year, we are expecting to do 35% better than that, and that's a reflection of the work of our teams, of course, and the reflection of the work of community pharmacies. I note that about 60% of people over 70 have already been immunized against COVID-19. I want to also note that in long-term care, we've gone, as you know, from the beginning of November to more than 20 outbreaks in long-term care, assisted living, and independent living, to one outbreak in long-term care at Ponderosa and Kamloops, and one outbreak in assisted living at Laurier in Prince George in the entire province of British Columbia. This reflects, I think, the effectiveness of the vaccine mandate, and I'm going to get to the numbers of healthcare workers who have been vaccinated in a moment, but that number is 99% across the province and no less than 98% in any health authority in BC. And those measures have had a significant effect. And obviously, for everyone involved, either as a family member, as a resident in long-term care, or works in long-term care, having booster doses for residents and healthcare workers in long-term care, and in the tens of thousands now of healthcare workers in long-term care have received their booster doses as well, and for family members and visitors, it is an important and successful effort to date. I wanted to note as well on the 5 to 11 vaccination program that we have. As of today, 146,426 people registered, or 42%. That 127,976 have booked appointments, and 73,457 children 5 to 11 have been immunized and have been vaccinated in BC. Those numbers are 42, 37, and 21%. And what that tells us is that we are quickly, of course, going to catch up to the number of people registered, because we're vaccinating at a high rate. And so what we want to encourage everyone to do today whose child is not registered with Immunization BC is to get registered and book your appointment. That this is an important way that you can protect your children and your family against COVID-19. And the program, as we say, across the country, in the hundreds of thousands, across the world, in the millions, have used a vaccine designed for children 5 to 11. And that program is going very well, but we need you to get registered. That's 1-833-838-2323 if you want to phone, but the best way is to go online through our Get Vaccinated website. And I just wanted to note finally that with respect to the campaign, we're expecting, as I say, to from the time of our announcement of the campaign, the end of October, to now, to do 1.2 million doses, which is an increase of 35%, and we're moving along very effectively and well with that campaign. And again, I want to express our appreciation to pharmacists across BC for that. I want to briefly comment on actions being taken with respect to suspicious vaccine records. Throughout the week of December 14th, letters will be mailed to approximately 1,715 people who have tried to submit vaccine records into the BC Provincial Immunization Registry without successful uploads. Letters will be personally addressed and will encourage them to get vaccinated at the earliest opportunity. Records entered into the registry are reviewed under strict processes to prevent fraud and to ensure people who are entered into the provincial system have, in fact, been vaccinated. Records that are submitted and are suspected to be fraudulent are reported to law enforcement. In addition, there are a small number of records that are not able to be entered due to a variety of issues and/or errors. The Provincial Health Services Authority will continue to work with the small number of British Columbians that have been vaccinated and are experiencing difficulty having their record entered into the registry. Currently, as you all know, people are required to be fully vaccinated with a complete series of Health Canada-approved vaccines to receive a BC vaccine card or federal proof of vaccination. I wanted to further just go on to a couple of regular updates. The first is around surgeries and around acute care capacity. On acute care capacity, as you know, we have 9,229 base acute care beds in BC, 2,353 surge beds for a total of 11,582. While the number of active cases of COVID-19 has been declining in our hospital in recent weeks, we do have significant number of people in hospital, as we typically do this time of year. That number is 9,335, just above our base bed capacity, and of course well below our surge bed capacity, but very significant. As you also know, we have 510 critical care beds in BC and 218 surge beds. As of today, there are 465 of those beds are full, so below our base bed capacity, but our hospitals and our healthcare workers are working full on. Regarding patient transfers, that number of patient transfers from the north has slowed as rates of transmission and case counts have slowed in the north. Regarding patient transfers, 153 total critical care patients have been transferred by air out of Northern Health to hospitals in other regions of the province, and 118 of those are confirmed with COVID-19. I want to just briefly update with respect to the issue of rapid testing, and just say that regarding rapid tests, for personal use tests, we need the at-home tests to be delivered by the federal government, and we've talked about this for a while, and they are working hard to get us those tests. We spoke about those as early as November. We are expecting a supply of these at-home tests to arrive from the federal government in mid to late January. Then we'll be taking immediate action. Those will be provided, and a plan will be laid out for the use of those tests. In the meantime, we have ample supply and ongoing supply of rapid tests, which we're getting from the federal government, to expand the use of them across our system. I just note, so that people know, 35,000 rapid tests are used every week in BC, and I believe the overall total tests that have been used in BC is 534,333. We'll continue to expand the use of rapid tests where appropriate, particularly in rural, remote areas and Indigenous communities and in businesses with congregate living, and in other circumstances such as the outbreak in Uvic. Rapid tests play a crucial role in our infection control initiatives, our transmission control initiatives against COVID-19, and they will continue to do so. And with the supply of more effective tests, ones that can be used at home, that role will continue to increase. And we are making plans, and we'll be presenting plans to you as that new product comes to British Columbia. Finally, I want to provide our weekly surgical renewal update. Health authorities have reported 6,609 surgeries were completed from November 14th to November 20th. That is 1,113 more surgeries than the same week last year, which contained a statutory holiday. While surgeries are continuing around the province, from December 5th to December 11th, health authorities postponed 114 non-urgent scheduled surgeries. That's 8 in Fraser Health, 17 in Vancouver Coastal Health, 5 in Vancouver Island Health, 80 in Interior Health, 4 in Northern Health. No surgeries were postponed in the Provincial Health Services Authority. The cumulative number from September 5 to December 11th, there have been 3,789 surgical postponements. Each of these patients will get the surgery they need. That is the promise of our surgical renewal commitment, and it is a promise that we have and will keep. I want to also note, of course, that the extraordinary work done by everyone in our healthcare system to provide those surgeries, the vast majority of surgeries, in fact, similar numbers to what have been done in the past are performed every week in BC, both urgent surgeries, emergent surgeries or emergency surgeries, and of course, non-urgent scheduled surgeries. Every one of those surgeries is important to us, and it is remarkable the extent to which, in the midst of two public health emergencies, that our healthcare system is responding to the ongoing need for surgery every day, every kind, in every hospital around BC. 18 months ago, in a briefing just like this, probably just here, we asked about our own experience with COVID-19. Do we fight or give up? Our answer was clear. In BC, we're fighters. We followed public health orders. We adhered to public health guidance. We used our COVID sense. And when vaccines were developed, when it was our turn, we got our shots. More so than, I think, almost any other jurisdiction in the world, both here in Canada and here in British Columbia. And then we started with boosters, more than 600,000 of them since we started. We're making sure our children aged 5 to 11 are protected by getting them the vaccines. Global surges of COVID visited upon us locally have always provoked the same response from British Columbians and from all of us. We do not give up. Not in the face of the earlier variants of concerns, not in the face of the Delta variant of concern, not in the face of the Omicron variant of concern, not in the face of any variant of concern, and there will be more. Because our BC pandemic is about moments and the difference we make in each of them. And that is the task that is before us now, one that we have proven time and time again that we are up to. In British Columbians, as British Columbians, we do not give up. We are going to continue to fight and do what's necessary in this period to protect ourselves while ensuring that the overall health of British Columbians is supported and protected. And we have, during this coming holiday season, new memories with one another that we all need to have for our overall mental and physical health. I want to thank all of you for all that you have done, and we're happy to take your questions.
Thank you. A reminder to media on the line, please press *1 to enter the queue. You'll be limited to one question and one follow-up. Our first question today goes to Rob Shaw, Check News.
Hi. Minister, can I just follow up on your rapid test comment? You said that if you could get that Roche brand take-home rapid tests from Ottawa by mid-January, you'd be distributing them in some way. So does that mean that BC would be providing them for free to the public to take home like we are seeing in other provinces?
The short answer is yes. So we've been talking, and I mentioned this in October, November. One of the things, there are different types of rapid antigen tests that are available. Many of them that we have are ones that require a health professional to take an MP swab, and we've deployed those in areas where they're most useful. There's also rapid tests that can be broken down into smaller numbers and given to people, and those we focused on areas like correctional facilities. We've been using them in outbreak management, schools. I also, as mentioned, we've been upping our ability to get rapid PCR testing available to people who've had exposures. But one of the things that we have been looking at for some months is the at-home test, similar to what is used in the UK. So they have lateral flow tests, they're called, which come in kits of about 5 with the dropper. Those are the ones that we had been hoping would be coming earlier on. And yes, our plan was to use them, particularly for situations where people have been exposed, where you want to understand if you're infected or not. So where your pre-test probability goes up because you've been exposed to somebody with COVID-19. So somebody in your family or your household's been diagnosed with it. You're a child in a classroom in a school where there's been transmission in that classroom. So while you're at home in isolation, you can serial test with the rapid antigen tests to see if you've developed this. And more those are going to be really helpful for us for those situations where people have had an exposure, where they're a close contact, where they've been vaccinated, and this is a means of determining rapidly without having to go for a PCR test. And if it's positive, then you go get your PCR test. So that's the program that we've been looking towards. Unfortunately, there is a global supply issue with many of these tests, and we've not been able to get them in the numbers that would be helpful for us across Canada or here in BC yet. I know the feds are working really hard on this. We've had a number of the at-home tests that have been approved for use, and last we heard is it's likely to be early January. So that is one of the strategies that we have been looking forward to. Right now, we don't have a lot of the tests that would be amenable to that type of a use in the community, and we're focusing on using the tests that we do have in the program that we have right now. So I think that's one of the things that we will be planning for and will be distributing. And yes, our testing strategy has been different from those used in other provinces all along the way, and we've really been focusing on making sure we get the right test and the right person, the right test at the right time.
Rob, do you have a follow-up?
Sure, thanks. Dr. Henry, could you just walk us through the Uvic rugby team situation again? How many people were involved in that? You mentioned a tournament at Queen's. How widespread was that tournament, and what did it mean for the Uvic outbreak? Could you walk us through that again?
Sure. So the last update I got, which was late yesterday, there's about 124 people involved with the outbreak at Uvic. It involved several large social gatherings off campus, but has many of the young people involved lived in campus housing. So the whole university community has been affected by this and is responding. And I think they're doing a great job. I want to put kudos out to Uvic and to Island Health in managing this. Young people have been supported to isolate at home, whether they are infected or contacts of cases. The age range is from 17 to about 24, so it is mostly younger people and very highly vaccinated population. So that means that we're not seeing severe illness. People are recovering, but it is still a challenge. So we're using rapid testing to support that. And what we found so far from the early tests, where the whole genome sequencing identified that there is probably several introductions, and there were a number of the cases are Delta, the AY variants that we're seeing circulate in around that Island Health. But we also know that there was some transmission from the varsity rugby team, which participated in a rugby game, and I don't have all of the details of who was, how many teams were there, but it has led to outbreaks in several other universities across the country as well. And so some of the more recent cases are related to varsity rugby players that have tested positive for Omicron. We have a number of more tests in the hopper for whole genome sequencing, so I expect that more of them. So it is a mixed outbreak where we're seeing both Delta and Omicron being transmitted in this group.
Next question, Richard Zussman, Global News.
Dr. Henry, what new restrictions in British Columbia should we expect before the holidays, considering that grim potential forecast you showed with thousands of new cases a day if things go in the worst case scenario?
You know, I think what we have tried to do is put in place the restrictions in those areas where we know transmission is the highest risk. So we have in place fairly strong restrictions around events and gatherings. One of the things that we are looking at is the events. It starts the vaccine card requirement and the other COVID requirements kick in at 50, whether we say all events and gatherings. need to have a vaccine card and the CD safety plans, so the plans in place to including mask mandate, including making sure we are checking the QR codes and the vaccine card. So those are some of the things we're looking at. We have, as you know, expanded the mask mandate, and it's really important now more than ever. This is a virus that's easily transmitted. Delta was easily transmitted indoors, in small particles. Those are the situations where it will spread faster. So those large host parties, we've seen what can happen with those, even if people are vaccinated. So what I am telling people right now is to rethink what you are doing over the holidays in terms of having gatherings with people, particularly large social gatherings with people that you don't know their vaccination status, you don't know their status. We need to be thoughtful about how we approach these holidays, and more than ever need to be prudent. Focus on protecting your family, your community. Focus on having those close gatherings with your close friends, with your family. We all need that. We need to have that the connection, especially after last year. We are in a different place. We have high rates of vaccination. We're moving up our booster dose program. We're protecting people. Those are the things that will help us, but we need to be thoughtful and prudent about our social interactions, especially over the next few weeks.
Richard, do you have a follow-up?
Dr. Henry, will there be any further measures put in place for the Vancouver Canucks considering another outbreak? I know they operate under strict COVID protocols connected to the NHL, but the team now has cases. Considering we had this outbreak with the team in March, is there going to be additional guidance from you about potentially postponing games considering these cases?
Yeah, so I know the NHL has very strict protocols about games and about how they manage those. I wasn't aware of the cases in the Canucks recently, but the protocols that the NHL has in place are important. I think it reminds us that, rapid tests, which are used in many of these situations, are not a panacea. They are one tool that helps understands what's going on, but everything else is important too. The things that I'm concerned about, are the watching the games, and we know that the measures that are in place. And right now, we need to go back to those basics: wearing our masks when we're watching a hockey game, particularly when you're in those places around the concessions, around the washrooms, moving in and out, where you're crowding together with people for a short period of time. Making sure that we are checking the QR code in those events. Those are important things. And if you are somebody who is at risk, whose immune system is not that strong, postpone going to those events right now.
Next question, Zhao Zhu, Globe and Mail.
Hi, Dr. Henry. You just said we are waiting for the at-home rapid test, but other provinces like Alberta is going to make rapid test kits widely available. Why BC is not making this free rapid test kits available to anyone who wants one?
Yeah, so Alberta and some of the other provinces, Nova Scotia in particular, have a type of at-home kit that we don't have in BC. We were a kit that's more amenable to being to distributing to people, the BTNX kits. We have not had those here in British Columbia, and part of our strategy was looking at where we would use them, and we were waiting on the other ones that we thought were coming before now. So I understand they are distributing a certain amount of those that they have through pharmacies, I understand, or through communities for people. Again, the strategy that we need to where those tests can be useful is where somebody has been exposed or has somebody in their household who is a case, and it can help you manage your risk during that period of time. And that's how I would advise people. I know Alberta is coming out with their program. I think they made the announcement today. It is important to know that this is one tool. It's one tool in many that we have, and that our testing strategy, as I've mentioned, has been focusing on getting the right test to the right person in the right strategies. They're not always perfect, and we've been modifying them as we go. I do want to caution that, especially in a highly vaccinated population, all of these rapid tests have limitations. When you are vaccinated, and we've seen this in Uvic, for example, you can have a low level of infection, and you're not shedding a lot of virus, and doing a single rapid test so that you feel that you can safely go to a party or something like that. These tests are not designed for that, and they don't pick up low levels of virus, even though you may be infectious in certain situations, that you may still be able to transmit the virus. And we've had challenges with both detecting the virus in somebody who has it, and in falsely positive tests as well, which can be as a third or sometimes even up to 40 or 50%, depending on the situation. So when we look at tests, we have to put it in the context of where they're being used. And there's examples from around the world, there's examples from here, where people have done rapid testing and gone to large group gatherings indoors where there's been a lot of transmission, despite everybody testing negative. So we can't rely on them for that sort of single use, I'll just test myself and I'm fine. We need to continue to take all of those precautions and to be mindful and prudent through this period of time.
Zhao, do you have a follow-up?
Yes, thanks. The provincial government is making rapid test kits available to business through Safe Green. Why does this program ensure that some workers get this service at government expense because they're being provided free, while others, if their business declines to participate, don't get this service?
Well, we have offered it. There's a number of different programs for businesses, and business organizations have been working with us and with the federal government directly. So there's quite a few. I think there's about 300 and close to 400 different businesses around the province that are using rapid testing in different ways to support ongoing operations. One of the ones that we were involved with early on, where we've really were pushing this to be an important adjunct to vaccination and other measures, is in some of the large industrial camps. We've been focusing on where, especially where there's group accommodations, so temporary farm workers, large industrial camps, the correctional facilities. But I know there's a number of other businesses. Maybe the minister can talk to some of those.
I mean, the numbers are significant, and again, when we make rapid tests that we, of course, receive from the federal government available, those will be free as well, of course. The about 377 organizations have been provided access to test kits for screening across BC, and a significant number of them, 141 with the Government of Canada, the remainder with the Provincial Health Service Authority in the province of BC. We know that about 35,000 tests are given a week, as I noted, well over 500,000 tests, 533,000 tests have been provided, rapid tests have been provided across BC, and that will continue to be the case. And we encourage more involvement in that program, not less. And so those programs are available widely, and obviously we're working with other sectors as well. As we get more access to rapid tests, we will be able to grow those programs. But we also want to note that we are doing now, and have been doing the last number of months, more gold standard PCR testing than we've done since the beginning of the pandemic, between 90 and 100,000 tests a week. And those are the tests from which we generate, and those are the tests that are required to support rapid testing as well where it occurs, should there be positive tests. And those tests are being done at a very significant rate in the province of BC, and those tests are where we get our regular numbers and our main understanding of the COVID-19 pandemic in BC.
Next question, Vinder Sajan, CTV.
Hi there. Dr. Henry, I'm wondering, when do you expect Omicron to be the dominant strain in British Columbia? And just picking up on what Richard asked with regards to restrictions, given the cluster on Vancouver Island with Uvic, Is that something that you're considering, some restrictions for that area? We know a lot of students would be going home for the holidays. So is some sort of like travel restriction on the table for Vancouver Island or between Vancouver Island and other places?
I'll answer the second one first. Just that, we don't have travel restrictions anywhere but it is a warning to people, of course. We take the risk from where we come and we bring the risk home from where we've been. So if we look across the country, we look across the globe, we are seeing this surges in cases of COVID-19, some of it driven by Omicron, much of it driven still by Delta. We're seeing it in Ontario, we're seeing it in Quebec, we're seeing it in France, Germany, in the UK. So people need to be aware of that. The protections that we have work when we use them, and that includes masking, it includes testing, it includes vaccination. Those are the key things. And yes, there have been measures taken by Island Health in and around the outbreak. We believe that it's contained in Uvic, and so things like the exams are gone to online, and the social events and a number of things have been cancelled over the last little while to manage that outbreak. But what we're doing, and what we have been doing all along, is taking that focused approach and trying to manage these outbreaks as they arise, these clusters in cases, whether it's a school, whether it's in a business, whether it's this larger one on Vancouver Island. So I think we need to recognize that this virus is with us and it spreads, and we cannot stop all of it spreading. But what we can do is take those measures that make a difference in keeping us out of hospital, that prevent us from transmitting it to people who may have more severe illness and end up in hospital. And I'm sorry, I've forgotten, Vinder, your first part of your question.
Do you expect Omicron to be the dominant strain?
It's too soon to say. We look at, if you look at the modern art picture of our whole genome sequencing, we had a rise of gamma and alpha at the same time. And there was a little bit of delta that was in there for quite a long time. Then delta really took off as we controlled those other two. So it's hard to know. Right now, we have very limited community transmission with Omicron here in BC. There's a lot more in Ontario that they're finding as they're doing that backward tracing and whole genome sequencing. But we also know it's more transmissible. So it's a bit too early for us to say a timeline of what might happen here in BC. We are continuing to do our case and contact management very actively across the province. That's one of the things that we hope will slow this down until we understand more about the virus, more about what are the important measures to control it, and of course to get more booster doses in people.
Vinder, do you have a follow-up?
I do. So just back to the rapid test, because I know there's a lot of confusion because federal documents show that we still have around 2 million rapid tests on hand. So how many of those can be taken at home, and why not offer the ones that Alberta is offering?
Yeah, so we don't have the ones that Alberta is offering. So that's there. They had a certain amount of a different type of tests that we don't have. About 1.3 million, 1.4 million of the tests that we have, so the federal government puts it in a big bucket, are ones that require a healthcare provider to administer. So they are ones that have a little test box, and it's a nasopharyngeal swab, and you do the swab, you do the test, it has the machine that does the test. So the machine is the limiting factor. You can't send that home. It needs, so those are the types of tests, the rapid antigen tests that we're using in the correctional facilities, in places where the test machine stays there and the test is done as people come in. We're using them in some of the long-term care homes and in some businesses. So those ones are not amenable to going home. So most of our tests, I think it's 1.28 million of those, are those ones that require the machine or require a healthcare provider. So the number that we have is about 700 and some thousand that could be broken down from the kits that they arrive in, which comes in boxes of 25 or 35 with a single bottle of the diluent. They could be broken down, and we are expecting some of the single dose bottles of the testing solution to arrive maybe by the end of December. But it's really challenging to break those down. It takes a lot of time. You have to get, it takes people power from a lab that has been running full steam, from public health people that have been running full steam. So that's the challenge that we face. We've been doing it on a basis of where we need them to send home with kids in a school that's had an outbreak. Uvic, for example, where we'll be breaking down about 10,000, but it takes a lot of time and effort to do that. So we don't have those test kits like the ones in Alberta that they're sending out that come in a batch of 5, like the ones they're using in the UK, which come in a kit of 5 with the solution for those 5 tests. So yeah, we've been trying to balance the resources that we have, the stretch that we have in our labs, and where we find those most useful to manage cases. And one of the things that I mentioned before is it really, they work best if you're doing them in serial testing, so testing every second day after an exposure, for example. So those are the types of situations we've been looking at. When we get the test kits that are put together, we will make them more available for people across the province.
Next question, Rob Brown, Dawson Creek Mirror.
Good afternoon. Obviously, noting a year of vaccination in the province, and it's been noted by both of you previously that it's a pandemic of the unvaccinated now. Wondering if the province is looking at, obviously having a list of those who are vaccinated and children that are getting vaccinated now, if there was a potential of the province comparing this list of the vaccinated with the BC health numbers, and then that would allow the province to leave no British Columbian behind as far as vaccination and potentially being vaccinated. Is that something the province is looking at?
I'm not sure I understand the question. To encourage people to be vaccinated?
I think I think that happens already. I mean, obviously, the reason we can give very precise numbers about the number of, say, healthcare workers or number of British Columbians who are eligible to be vaccinated and numbers who aren't, is that we know. And and we have a very comprehensive database of both those who are eligible for vaccination and those who can be vaccinated. And the numbers who over 12 represent about 9%. And I can tell you, for every one of those people, they are welcome anytime to get vaccinated. And that group of people represents, of course, that small group of people represents the vast majority of critical care cases we have in the province, because the Delta variant has been particularly hard on unvaccinated people. So everyone's eligible for vaccination. Certainly first and second dose have been widely available, and everyone has been offered it at the latest by July. And we're working hard to convince the small number of remaining people to be vaccinated, and working hard in new groups of people, like children 5 to 11, to get them vaccinated as well. But the numbers are impressive. We have them all. We have a set. We know by, and we provide by local health area, by community health service area. Dr. Henry did today the detailed information on who's vaccinated and who's not. And everybody's welcome, whether they're residents of BC or not, whatever their circumstance. If they're in BC, they're welcome to get vaccinated.
You have a follow-up, Rob?
You can walk into a pharmacy in many parts of the province, and I know for many people it's still that making it convenient for people. So walk into a pharmacy and get your dose 1.
Go ahead with your follow-up, Rob.
Different topic somewhat. I think it was touched upon by some of my colleagues, both in the presser today and then in the tech brief previously. But this comes from our Warriors of Freedom. They were sending me some questions this week, and they want me to ask you if the province this week or before Christmas is going to be implementing a health pass or a passport system as it relates to walking into grocery stores in British Columbia.
No, our BC vaccine program was thoughtful, and we put a lot of thought and time and effort into what was included in the BC vaccine program. So what is included in the BC vaccine program are businesses like restaurants, where having vaccinated customers is another measure that allows us to keep those businesses open and functioning. It means being able to go to theatre, being able to go to arts programs, being able to go to see the Canucks, being able to go to see the hockey game in Kelowna and in Kamloops and in Chilliwack. And it is designed for those things where there are alternatives for people. So you can do takeaway, you can watch it on TV, you can watch a music program, whatever. So it is areas where we know it's higher risk because they're indoor settings, and where we want to be able to, they're in some ways discretionary, but we want to be able to mitigate the risk for those people in those settings and keep those businesses open and functioning, because we know how important, the arts and music and symphony and sports is to our mental health, our physical health, and the functioning of our community and children. So it was designed specifically for that, and also an incentive, of course, for people who want to do those things in person, to be vaccinated and to do their part to make it a safe environment as much as possible for people. Where we do have is mask mandates, and those are designed to protect the workers in those settings and other people in those settings, but primarily the workers, because if you're in a grocery store, it's the workers who are there all the time that you're coming into contact with. So keeping your distance from people, we've learned to be respectful in retail environments. And I just want to say a thing about this. No, we're not going to make it part of the BC vaccine program, but it is a requirement to wear masks in those indoor settings, retail settings, malls, and grocery stores, for example. And I know there's been some concerns that people are saying, I have an exemption so I can just walk in freely. That's not the case. There are alternatives that we can accommodate people who have a reason why they can't wear masks, and that doesn't mean that you're able to just walk in and do whatever you want. It means that you can do online ordering of your groceries. You can have curbside pickup. You can have somebody, and I know many retail outlets are doing this, where people will get what you need and provide it to you either curbside or drive-in. So there are alternatives for people who feel strongly about not wearing masks, and it doesn't mean you have to be antagonistic and put people at risk. And that's really important right now. When we're in indoor settings right now, it's really important that we take those respectful measures that protect others and protect ourselves.
We have time for one more question. We'll go to Belle Curie, CBC.
Hi there, and if we could have the answers in English and French, please. Dr. Henry, so will BC make booster doses available now for everyone, since it appears that 2 doses of the vaccine don't offer enough protection against Omicron? And if that happens, do we have enough vaccine, enough system capacity to do 2 doses for children and booster doses for everyone else at the same time?
So our booster dose program is a booster dose for everybody over age 18. That's what it's been from the very beginning. And the logistics of how we're doing that is exactly what we're talking about. How many people are due at 6 months? And, NACI has reaffirmed that that's still important. And that's important because it gives us that longer lasting protection, not just for this variant, but for the next variant, for next winter as well. So 6 months is the interval that we're working towards, and every adult over age 18 is eligible, and that's why we're bringing on pharmacies. That's why we have ramped up our provision. We've been focusing on those most at risk first, as we did with our initial primary series, and that also corresponds with the people who are furthest from their dose 2. So every adult in BC is eligible for a booster dose at 6 months from dose 2, and that is how we're going to be rolling things out and what we've been doing already, and what will happen. They can't all get their booster dose. Most people are sort of due for their booster dose come January, February. That'll be 6 months for the elephant, as I call it, of the dose 2s that we were giving in June and July and into the 1st of August. So we are planning for that to be moving through over the next 3 months. And that's the vaccine that we have for that. That's why we're expanding to pharmacies, so that we can expand the numbers of places people can get it in their community around the province.
And just briefly to reiterate, we absolutely encourage all parents of children 5 to 11 to register their children. Say about 75,000 doses delivered as of right now, and that's now a majority of those registered, and we will be closing in on that number very quickly. We need more registered children to get vaccinated in this period. It's going to be it's a very positive thing to do with respect to booster doses. As noted, we announced our program 7 weeks ago that everyone's going to get their booster dose in BC, and that we focus in the areas we focused on are the areas we focused on at the beginning of the pandemic for first doses and second doses, which are long-term care and healthcare workers and Indigenous communities and our elders and people who are clinically vulnerable. And that will continue to be the case. And we announced a program towards the end of October, and in the first month and a half of that program, we're going to deliver 35% more doses than we thought we were, which is a real success for everyone involved in the program. So we're increasing the capacity to meet the demand that's coming with people requiring a booster dose after their first and second doses. Je dirais en français que les doses, les troisième doses pour des gens vont être offerts à tout le monde dans la province. Chaque adulte dans la province, chaque personne qui a plus de 12 ans va recevoir son troisième dose, son dose supplémentaire au premier tour de dose. Et ça va se dérouler dans les mois à venir. Et nous sommes maintenant avant l'horaire qu'on a désigné au commencement du programme. C'est une réussite de nos gens qui travaillent dans notre programme de vaccination et pour les gens de la Colombie-Britannique. Et j'encourage tout le monde qui n'est pas vacciné jusqu'à maintenant, de nous rejoindre aussi. On a vu dans la présentation de Dr. Henry qu'on a 33 il est 32 fois plus probable qu'on est à l'hôpital à cause de COVID-19 si on n'est pas vacciné, 32 fois. Et il faut quand même, on peut changer cela, et on peut changer cela en étant vacciné aussitôt que possible.
Al, do you have a follow-up?
Yes, please. Also in English and French. A woman in her 40s is telling us that she nearly died from several blood clots soon after her AstraZeneca shot back in April. Her hematologist has said she needs an exemption, despite the exemption form saying that those people with this vaccine-induced condition don't need one. She's received a note from the Deputy Provincial Health Officer saying work is being done on potential exemptions in the future, but none have been issued so far. So where are you with that, and when can we expect to hear more about this? Would someone in this case be considered for an exemption?
Yeah, so what we have been focusing on is people who, the healthcare worker program and people who have a medical reason why they can't get mostly a second dose, very similar to the condition that this person has had experienced. And yes, we are working through that process. We initially said that we would have no exemptions to the vaccine card program, and I guess that's what you're looking for. She wants to be able to have a vaccine card to be able to attend events, for example. And we have started a process for that as well. As you can imagine, it's a complicated thing, and it's challenging for us. So because the vaccine card is a time-limited intervention program, though we are reassessing it in January, as you know. However, I do expect that it's going to be in place longer than January. So we have started a process to be able to get people a valid BC vaccine card for the BC vaccine program with a medical exemption. But it is a slow process, and I know my office has been in contact with a few people who are in a similar situation. And if she received a letter, then she's one of them. And yes, that process is underway. I will say that we do not have control over the federal vaccine process. So that is a different process, and I don't know what the process is, for example, for travel, for verification for travel. Yeah.
I think what we're talking about is exemption from the BC vaccine card. I think that's what's being requested, not another sort of exemption. Je dirais qu'on a dit au commencement du programme de BC Vaccine Card qu'il n'y aura pas de gens qui sont exclus du programme, c'est-à-dire qu'il faut être vacciné pour recevoir une carte. Depuis un certain temps, on fait une considération de cette question pour la petite minorité des gens qui ne peuvent pas être vaccinés, et on travaille sur cela maintenant. Donc ça continue à être le cas qu'il faut être vacciné pour recevoir une carte de vaccination en Colombie-Britannique, et on travaille sur cette question, et ce travail continue. C'est important pour les gens, mais il faut dire que le BC Vaccine Card est un programme réussi parce que c'est un programme clair, et donc de faire des nuances dans ce programme présente des difficultés aux gens. Donc on travaille fort sur cette question, mais pour maintenant, pour recevoir un BC Vaccine Card, il faut être vacciné. Thank you very much.